Welcome to the second day of the California Labor Lab's conference on precarity and employment. I'm Ed Yelin. I met you yesterday to introduce it. And today I am going to give you an overview of what people said yesterday with a very selective sampling of the pearls. I have no more disclosures today than yesterday. I opened by saying the future of work is now. What has emerged over the last several decades is a systematic effort to deflect responsibility for workers' welfare. That has already occurred and is an important organizing principle for employers. The strategy upends protections for workers developed in the 20th century. You need a workplace to receive workplace protections. And the manifestations of this, the central focus of our California Labor Lab, are alternative ways of hiring workers, contingent employment, and the erosion of working conditions. Jacob Kapker, whose talk was entitled The Great Risk Shift today, talked about the strategy of shifting risks away from firms to workers, generalized within developed nations, but it differs among nations. Our safety net here is insufficient to buffer workers from the degree to which risk shifting has occurred compared to other developed countries. The means by which firms shift risks is to cut back on employee benefits while supporting tax reductions, which starves governments of the ability to compensate for the losses. Kristen Hartnett and Daniel Schneider talked about shift work and its consequences. They talked about the strategy, the service industry, which is central to the economy, which is rife with low wages, few benefits, underemployment, just-in-time scheduling, and earnings volatility. The set of strategy results in worsened health and well-being. But companies differ in the extent of implementing the strategies with regard to wages and conditions, and there are some high-road employers despite the strategies. Local laws can make a difference in the absence of federal laws and regulations, as they showed with Seattle's regulations. John Schwartzberg then talked about the translation of work precarity into health problems. The modern economy, in some ways, is no different in many respects with traditional occupational exposures continuing. And toxins, ergonomics, overwork, and underwork are all risks. What he showed was, in the Whitehall studies of Marmot and colleagues, some startling results. When viewed alone, individual behaviors, somehow this got shifted, individual behaviors like drinking, smoking, exercise, and obesity do affect mortality. But when viewed in the context of stress in general and work-related stress in particular, almost all of the effect was due to stressful working conditions. High demands and low control are the toxins of modern employment. Mariano Ventura gave a talk on domestic workers defining a new model of the future of work. Care work, taking care of dependent populations and their health needs, as well as of homes, is central to the functioning of both the home economy and the national economies. Care work is often invisible by definition and not often afforded standard protections of the workplace. For example, Social Security didn't cover domestic workers initially. Low pay and poor working conditions are embedded by the characteristics of domestic workers. More likely, this work is done by women and members of racial and ethnic minorities and immigrants. Christina Maslach, whose talk was titled Meeting the Challenge of Burnout, talked about how burnout is a widespread phenomenon, but is a misunderstood one. It's a combination of feelings of exhaustion, mental distance from the job, which results in cynicism and reduced efficacy on the job. It's conceptualized as a failure of the individual to cope or being resilient most often. And we have a wellness industry that's built on the notion of helping the individual deal with conditions of work. But burnout is actually the result of the structure of work: demand overload, lack of control, insufficient reward, breakdown of workplace community, absence of fairness and values or ethics conflicts. So the tie that binds these talks is shifting the risks to the individual from the community, sometimes in the guise of freedom, as is often the case is made with gig work, that workers are given freedom to work as they want and to make sometimes sub minimum wage earnings. So the schedule today, we begin with a talk by John Howard, who is the director of the National Institute of Occupational Safety and Health, talking about work arrangements and worker well-being. He will be followed by Manal Azi from the International Labor Organization, who's going to be talking about emerging working conditions, occupational safety, health interventions, and advancements. We'll have a break and come back with a talk by Monica Anderson of the Pew Research Group, who did a very good report on the state of gig work in the United States, about which she will report today. After that, Emma Goldberg, the New York Times Future of Work reporter, is going to give a talk entitled How COVID-19 Changed the Workplace, something that she's monitored closely these last couple of years. We'll have our lunch break for those on the West Coast, coffee break or cocktail break for those on the East Coast, followed by perhaps the most important session of the two-day meeting, our policy forum with Victor Rubin, the director of policy for our center, Ash Kalra, a member of the State Assembly, Beth Ross, who's done important litigation on workers' rights, and Renee Bayardo of SEIU, and Laura Stock, director of the Labor Occupational Health Program at Berkeley, and a member of our center as well. Throughout most of the conference, we've been touching on ways of ablating the bad working conditions which have arisen, but this is the entire focus of the policy forum. And then Christina Banks and I will come back to close this out.